Alright, so I'm going to be entering the room, providing patient privacy, introducing myself. My name is Joel Reyes. I'm a nursing student. Today I'm going to be applying a urinary catheter. Could you give me your name and date of birth? After the client has given me the name and date of birth, I would then check, hand hygiene first before I touch them. Check the wristband to confirm the identification, and then begin to explain that I'm going to be providing this catheter for post-surgery or for any urinary incontinence reasons. I'm going to make sure my table is clean. Place my materials here. Would usually have a bath blanket, but I guess we don't for right now, which is fine.
You can verbalize.
I would get a bath blanket to help provide more privacy, so that the patient is also warm and covered and feels more comfortable in this. And this normally wouldn't be in here. These paper towels are going to be for the pericare, because I don't have...
Okay, your washcloth?
Yes, my washcloths. And I would usually go get gloves, well, wash my hands, get gloves. Ask the patient if they have any allergies or any questions or concern before I started. And I would then begin by letting them know I'm removing, well actually, I want to raise the bed to an appropriate height. Let the patient know that I'm raising it so that it's for my safety and theirs. I'm going to begin by letting them know I'm removing the top sheet so that their entire legs are exposed. We'll be placing the bath blanket on top of them, telling them why, for their privacy, and letting them know that I'm going to be exposing the vagina so that I could see if there's any discharge or any issues prior to starting, any redness, any discomfort, and there doesn't seem to be. So I'm going to leave this up. I would get my washcloths to perform pericare. Start by cleaning with one on the furthest side away from me. Garbage. Then the closest. And last but not least, from top to bottom, all the way down to the anus. Oh, sorry, I'm supposed to lift the client's legs prior to pericare so that it gives more room to work with and they're more comfortable and there's a proper hygiene being done. After pericare, I'm going to now set up, well, I want to check the expiration date on the kit that I have to make sure that it's not expired and that it's the appropriate size for the person and that it is the right order as well. Okay. Sorry, before I do that, I want to remove my gloves, hand hygiene. There's no other gloves around, but I would put a new pair of gloves on just to keep it more sterile, as clean as possible, I should say. Take out the kit. Now, because the outside of the kit isn't sterile, it's fine to place it on the bed, I'm going to open it away. Clean down the sides without touching the middle, because that is the most sterile part.
Use that as your garbage.
Oh, this is my garbage? Okay. Well, that doesn't go in there, that would go in the dirty laundry bin.
Put it in bed.
I just don't want to touch the sterile field. I'm going to begin by grabbing the gloves. I'm a lefty, so I'm going to start with my left hand first, and then my right. Okay. And I have sterile gloves on, I can touch the inside of here. To adjust this, I'm going to place down my sterile field, white side up. We won't be using this. Sorry, this is in the garbage. We won't be getting any specimens either, so that can go there as well. I'm going to start by removing this plastic slip here off the catheter. Place the box here for right now, just so that I have more room to work with. I'm just prepping the catheter so that I have an easier time to work with applying the saline into the balloon. I would then open the lubricant, place it in the appropriate place in the container here so that it's ready to be applied on the catheter. I would then take out the iodine swab sticks, begin by cleaning the further side, discarding the first swab, then the closest side, discarding the next swab, and then making sure that I spread the vagina so that I can clean from the meatus all the way down. And then dispose of this in the appropriate receptacle. So now that the patient is sterile and ready, I'm going to apply the catheter into the lubricant. With my non-dominant hand, I'm going to keep it placed here on the perineal, the vagina, so that I can spread the lip to then insert the catheter. Asking the patient and letting them know that they might feel some discomfort, but they should not feel pain, and to let me know if I need to stop if there's any issues. I will then begin to insert about 2 inches till I see a flash of urine. There's a flash of urine, and then I will insert an additional 2 inches. I will then begin by inserting the saline solution, slowly, keeping an eye on the tubing on the catheter to make sure that it is not incorrectly inserted, so that it's not overfilling the main line with the saline and that it's getting into the balloon. Now this doesn't go into a regular garbage, this goes into a sharps container for safety purposes, but for right now we'll say this is the sharps container. I'm going to then slightly pull on the catheter to make sure that there's tension, letting me know that the catheter is properly inserted and the balloon is inflated. Okay, so now I'm going to actually remove these, and I would be putting on, or I'd be cleaning my hand hygiene and applying clean gloves. That does not go there. This goes into the garbage. Hand hygiene, gloves. And I would tape this to the leg closest to me here, making sure that this tubing isn't pressing into the patient's leg for their comfort and for the purposes of acquiring urine for any reason. That's taped there. I'm going to put the catheter bag on a non-movable location on the side of the bed. Taking my gloves off, hand hygiene gloves again, so that I can perform peri-care. Fortunately, I only have one of these, so just imagine I had more washcloths. Going to begin by cleaning the furthest side, disposing of the washcloth, closest side disposing, and then the center, and disposing into the appropriate receptacle. After all that is complete, I will then begin, since this is no longer a sterile procedure, at this point, remove all of the materials I was working with.
You can clean up afterward, just,
I'll pick it up after.
it's fine.
Then begin by placing client's legs back to a comfortable position. Asking them if they have any discomfort, making sure that they're okay. Bring them back up, removing the bath, with the bath sheet on top of them. giving the patient their call bell, lowering the bed back to a safe position, asking the client if they have any concerns, questions, or any other needs before leaving the room. Hand hygiene,